Hi. So far, we have discussed genetics, embryology, and basic biochemistry, of course, in very short, brief forms. And here I'll have a brief summary of our blood, which is very important component as we discussed earlier in transferring substances all across the body. So the blood has two main components: the plasma, which is a liquid component made mainly of the plasma proteins and water, and the cells, which have different functions. In the cellular component, we have red blood cells where the hemoglobin carries oxygen to the tissue. So hemoglobin is a very specialized protein, and it also is a common heme and protein complex. It's structurally devised to carry oxygen. If you are more interested in learning about this oxygenation process, I will link the playlist on oxygen in the body, especially the first video on how oxygenation is important in the body. White blood cells are a defense mechanism. So the leukocytes, the neutrophils and monocytes play a part in the innate immunity, and through memory cells and T lymphocytes and B lymphocytes, they play a role in active immunity. So if we have a deficiency of white blood cells, our immune system is weaker. The third component, cellular component in the blood, is the platelets, and they are very important for hemostasis or clot formation. Suppose there is a cut in a vessel, the platelets quickly clump together and then it activates a clotting pathway, and this helps to stop the bleeding. The plasma proteins are a complex factor, and there are multiple proteins. Albumin is the most important in terms of quantity and function. It has a huge role in maintaining the oncotic pressure, so it retains the intravascular volume because the water stays in and doesn't leak into the capillaries because of the albumin being present in the blood vessels. The immunoglobulins are another important component in the blood, and as we know, immunoglobulins are important to fight infection. Complements are other proteins which also help to fight infection. And we have a clotting system. We have factors which are pro-clotting or procoagulant factors, and factors which inhibit clotting or anticoagulant factors. A good balance of these is important to prevent bleeding or thrombotic manifestations. Almost all the proteins in the body are produced in the liver. So the liver is a very important organ, and one of the aspects of liver function is to monitor the level of protein in the blood. Just a quick mention of hematopoiesis, which is the steps involved in producing the blood cells. So usually when the baby is in the womb or in the fetus stage, the liver and the spleen are involved in blood cell production. Towards the middle of the pregnancy, the bone marrow, which is the site which produces the cells in children and adults, takes over. The bone marrow is nothing but fluid-filled cells, vascular area in the middle of the bones, especially the long bones like the thigh bone, and the hip bone has a lot of bone marrow as well. So this bone marrow has specialized cells called stem cells. They differentiate to the different lines that produce erythrocyte in the case of erythroblast. Megakaryocytes release platelets, and myeloblast leads to myelocyte and white blood cells in different forms of maturation, and monocytes as well. Sometimes we have blood cancer or leukemia where there is abnormal proliferation of these myeloblasts, and we also have congenital anemias or congenital platelet deficiencies due to problems related to the stem cells related to these lines. A few terminologies related to the blood. Anemia means a low hemoglobin. When we have a low hemoglobin, the blood can carry lower level of oxygen, and because our body needs a certain level of oxygen, your heart actually has to work more to pump more blood. Your heart rate tends to be higher to compensate as well. And we also know that anemia can happen due to various conditions. Nutritional anemia is the most common, and iron deficiency is a contributing factor. We have vitamin B12 and folic acid also as important components which are needed for the iron hemoglobin synthesis. Blood loss can happen in females due to heavy periods. It can also happen due to chronic disease where the synthesis of red blood cells in the bone marrow is affected, like in chronic renal failure. Intestinal lesions like inflammatory bowel disease may lead to blood loss. Polyps in the intestine can lead to blood loss. Worm infestation in developing countries is an important factor because there are hookworms which actually suck blood from the intestinal area. Malaria is an important cause of anemia in areas where malaria is endemic. We also have bone marrow disorders, leukemia, for example, where the cells multiply, they displace the red blood cell multiplication factors and they become anemic as well. In the case of white blood cells, if you have a low neutrophil count, it's called neutropenia and they are prone to infection. It may happen as a after effect of viral infections. It can happen due to medications that you take, or it may result from factors like congenital neutropenia. Low platelets is called thrombocytopenia, and if it is very low, they can have a risk of bleeding. Most of the causes of thrombocytopenia are autoimmune conditions, either factors like systemic lupus erythematosus or isolated immune thrombocytopenic purpura or ITP. The body produces antibodies against the wound cells, in this case the platelets, and there is a deficiency of platelets. Clotting factor deficiencies can also happen, which lead to risk of bleeding, or in some cases like excess of protein C, they can have thrombotic tendencies. Hemophilia is one example, where hemophilia A is due to factor VIII deficiency. It's usually X-linked condition and the boys are affected and the girls are carriers. Hemophilia B is due to factor IX deficiency, and these are major hemophilias where if the bleeding happens in a deficient child, it can lead to life-threatening bleeding. We will also cover the lymphatic system. Lymph, when the blood pumps from the heart, it reaches the arterioles, then it goes to the capillaries where there is exchange of oxygen. Some fluid seepage into the tissues happens at the capillary level, and then the capillary blood comes back into the venous system. This seepage of blood is the interstitial fluid, and the lymphatic system basically helps to remove this interstitial fluid back into the fluid and into the blood system. So the lymphatic system connects into lymphatic vessels, which then join the venous system. So we have a main lymphatic vessel called the thoracic duct, which joins into the superior vena cava, and we have many lymphatic vessels in the lower part. These are chains of lymph nodes. So the lymph nodes are nodular structures present in the pathway of the lymphatic system. The lymph vessels meet at the lymph nodes and then they progress on. It kind of acts as a filter. It's part of the immune system of the body. We also have the thymus and the spleen, which are part of the lymphatic system. The spleen acts as a reticuloendothelial system filter. So if there are damaged blood cells, the spleen blood vessels are very tight and these blood vessels break down there. In some conditions like thalassemia, the spleen is dilated, and because the spleen is very big and blood keeps going through it, it may itself lead to fragmented cells and hemolysis. It's supposed to remove the old RBCs which lose their membrane, but some conditions with hypersplenism, you may become anemic because of that. The thymus is usually prominent in the newborns and it has a role in the immune maturation. There is a hormone called thymopoietin which is produced by the thymus. In the newborn x-rays, you would see the thymus as very prominent swelling. You can confuse it with the heart enlargement or shadows in the lungs, so you have to be aware of the position of the thymus in the newborn. When we do the physical examination, we feel the different areas, for example, the cervical or the neck lymph nodes, the axillary lymph nodes. This is a very common area involved in breast cancer, for example, and the inguinal lymph nodes. The abdominal lymph nodes sometimes become big, especially in malignancies of the lymphatic system. You can have Hodgkin's lymphoma or non-Hodgkin's lymphoma. So just like the leukemia is a cancer of the blood, white blood cells, lymphomas are cancers of the lymphatic system. Luckily, we have good treatments for both leukemias and lymphomas, and the outcomes is fairly good. So the thymus, lymph nodes, even the tonsils at the entrance of the pharynx are part of the T lymphocyte maturation system. And as I mentioned, the lymph interstitial fluid that doesn't return to the capillaries turns to lymph. It also has a role in the fat absorption in the intestines. So the fat absorption in the lymphatic systems, lacteal system it's called, and it can get absorbed. In the next presentation, we will discuss the cardiovascular system. So this is a short summary of our hematologic system. Thank you.